Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hello and welcome back, everybody. Today we have with us Dr. Ellen Tsai, who is going to be walking us through her interesting and varied, career. So welcome. I'll let you introduce yourself.
Oh, thank you, Sarah. So my name is Ellen. So my background in medicine is in pediatric critical care. I worked in academic practice for over 20 years, and I also taught bioethics to medical students and residents in training and practicing physicians. It was a really interesting way to sort of diversify my interests in academic practice. I also taught law students. It was like a lot of interesting things that I encountered over the way. And then for the last almost 13 years, I've been working with the medical indemnity organization in Canada. So for Canadian physicians, it would be the CMPA. And I've just recently retired from that organization. So I work there as an educator, also provided medical legal advice. And then I also most recently supported physicians in a program called Member Sport Program, where I also coach physicians. So that's really kind of my interest now.
Yeah. So interesting. So what took you to pediatric critical care? Let's go all the way back.
Yeah, for sure. Well, it's hard. It's funny, I've done a lot of mentorship of medical students over the years and residents. And what I really liked about pediatrics, I think, was the idea of growth and development, and really a very dynamic environment. So, kids. I took care of kids of all ages, from newborn babies all the way up to age 18, and even a little bit beyond that. Um, so there's so many developmental things that happened. So there's the whole, physiology of as children age. There's developmental stages. There's this family-centered approach to care that I think, I'm a team-based physician anyways, but the unique part of our team was the parents and other family members. So I really appreciated that sort of collaborative environment. And yeah, so it's funny because one of my colleagues says, we were talking about gardening, and he's like, yeah, you're a pediatrician. You like to watch things grow. I said, I guess that's what makes us gardeners as well, that we kind of like that aspect of
Yeah, yeah.
yeah.
Now, critical care, is that within the ICU predominantly,
Yeah.
or are you mixed in different environments within the hospital?
So critical care, so the hospital I worked at was a smaller hospital. So we had we were actually in a part of a combined adult and pediatric ICU. And then we also had sort of a step down area, what people call step up or step up, sort of a area as well. That was just pediatric, that was located with the pediatric ward or unit. So yeah, but really that was my focus. Was I didn't do ambulatory pediatrics. I did only critical care, or once I'd finished all my training.
All right. How do you look after yourself in that environment when you're seeing the sickest of the sick kids? What does it look like to have gone through that career? What some of the challenges, and how did you look after you doing that?
It's a great question. I think the challenge actually is finding balance. For sure, there's having said that, people often say to pediatricians, "Oh, I could never do that work. It's so stressful. How can you take care of sick children?" And I say to them, "I can't imagine what you do. How do you take care of all these sick elderly patients?" And so, so part of it, I think we choose the area of medicine that we find fulfilling, rewarding, and we accept the challenges that come. I think for most physicians, you accept the challenges that come from the choice that you make. So. Nobody needs to feel sorry for the pediatric intensivists because we chose that specialty. There was I guess compared to the adult medicine, there's a better, higher survival rate, and so that, there was, you could, I guess, part of it is just being able to see that the ability to help, the ability to support, the ability to watch, really sick children actually get better for the most part. And then when we weren't able to do that, then we were there to support the families and particularly the parents, but
Hmm.
also their extended families, and in a way that was meaningful and important to them. So being able to see that part of the work that we do, that we support patients and families regardless of whatever is happening. So I think having a purpose, having a clear sense of purpose, really helps you to stay grounded in terms of the work. And then the workload is challenging. Anybody in academic practice knows that, I don't know, some days I wore 4 or 5 hats and I thought, I don't know how I'm doing this. So, I'm not necessarily the poster child for balance, and maybe that's how I ended up in, being coached at one point, and we'll talk about that later. But I do think I tried to find balance through other hobbies. But some of my hobbies include music. Um, so weird things like musical theater, performing musical theater. I also did a lot of rock climbing, and so trying to do some outdoors things, gardening, other, staying in touch with friends, trying to, you know, ma manage to see friends as much as possible within the bounds of an on-call schedule.
Got it.
But I
Yeah.
also, yeah, and I also found it extremely rewarding to, as an educator, work with students. So that was, in some ways, those are the ways to recharge. It's finding the aspects of our practice that we really enjoy, that actually bring us joy and bring us energy, that energize us, that make us feel, yeah. So I was busy, but I also found a lot of things both in and out of work that helped to recharge me.
Hmm. Got it. Okay. Okay. So there's that going and not working when you're off, you're off,
Yeah,
doing fun
yeah,
and
that's
interesting
right.
things.
Yeah.
Tell me about inside the workday, from your recollection of it, in terms of getting the volume of the work done, the documentation of the work done, the
Mhm.
team dynamics. Is there anything about that that made it better or worse for you within that time?
I think I really relied on the people I worked with to be helping me, to have for all of us to have each other's backs,
Hmm.
to communicate well, to, the residents letting us know when they were worried about the patients.
Hmm.
The nurses also similarly to communicate that we made, um, I think as physicians to just make the best use of the team members when you can, not to feel like you have to do everything. I mean, realistically, would have been impossible for me to do everything.
Hmm.
So I really needed to rely on other people to be able to help with the care of the patients. And so we really, I think, for that environment, really, if it really is about being able to communicate and collaborate, and in a way that's, synchronized and respectful and also very supportive.
Right. Yeah, yeah, yeah. How did you onboard registrars to or residents to that environment to become part of a well-functioning team? Are there any pearls of wisdom you have that help to bring newbies in and help them understand what it looks like to communicate well in this environment, what we do want you to hear from you about?
Yeah, I think, creating that safety, I think, I'm also speaking about my future experience. We talked a lot about, how do we promote safety? I think for learners, whether they're, medical students very early on, or whether they're more senior registrars or residents or fellows, this idea that we have to be able to speak up clearly when we're concerned, when we're worried, and be okay with admitting that I don't know, or I'm not sure, I need some help. Certainly my experience um, with learners is the ones that got in the most trouble were the ones that actually couldn't say that, that had difficulty, accepting or receiving feedback, or just even admitting that they didn't know something, and the culture of medicine promotes that. I think the learning environment promotes that. Unfortunately, there's a bit of I mean, the culture is changing over time, but I think there is a bit of that idea that, I think we have difficulty admitting when we don't know things or because it makes us seem weak or look weak in front of other people.
Mm. Very interesting. Um, I like your reflection there that you're creating a safe place for your learners and that not every area of medicine has this same. You sound like the type of mentor that we would all want. Or the
Well,
type of preceptor we'd all want that says,
well,
we want
you
to hear from
learn.
you. We want the
You
right
learn.
answers.
Yeah.
Don't take this on board yourself.
Yeah.
We want to be
Yeah.
part of your team.
Yeah.
I know that just reflecting back on my own critical care training, it was 18 months back, way back when I just finished all my things required for internship and I did a critical care. In the ICU was the time where I learned from my critical care mentors that ability to be honest with families, because you're
Mm.
often not talking to the patient, as you know, the ability to be honest, not harsh. You're doing it with kindness, but you're helping them understand really difficult things about their loved one. And so those conversations in those quiet rooms where you're really helping a family understand the bad and the possible and the plan, and that ability to translate that difficult feedback, difficult conversations with their learners. And I think that is a skill set.
Yeah. And also, I would say also, just listening to, I was just thinking about your question earlier about how do you onboard, these learners? It's also teaching them to listen to everybody else on the team. And so a lot of the meetings that we would have updates with families as well, we would also include the nurses. The nurses had something valuable to offer. They would often be the ones speaking to the family members after we had had our meeting. So we would have
Mhm.
our formal meeting when you meet with a family. I mean, I would still meet fairly regularly with the families, but in between times at nighttime, would be the nurses talking to them. So it was good for the nurses also to be aware of what we were communicating and to be and that we would agree that this was, the direction we were taking. It doesn't help to have somebody who undermines anybody else by providing a different message. It doesn't mean that we couldn't disagree. Yeah, I don't mean to say that, but I think that's important as well. And I do think what I found early on in my training, I did adult ICU as well in part of my training. And I also noticed there were people who had a lot of courage to speak, um, really communicate openly with families. And I also found there were people that were not necessarily good at that. I think they were just afraid. They were, if I think they're honest with themselves, they're afraid to say something that's going to be upsetting. It's going to be incredibly upsetting to say that I don't know if your, family member will survive. That's a really tough thing to say, but we have to be honest. And I think, in my work, I would say when I was worried, I would say also when I wasn't worried, I'm not worried. Your child is very sick, but I do think they will, I believe they're going to get better. So we're here to support you. But I think it was also important to be honest, because then family members were prepared, for that eventuality if it did happen.
Yeah, yeah.
But it does take a
That's a
lot of courage.
It does. It does. I think courage is a good word for that, actually. That it takes courage to be able to speak your current truth about this situation for this
Mm.
family. And again, with that element of kindness too, it's not brash or it's a very hard conversation to have, but it can
Yeah,
be. It's so nice to see it mastered when it's
yeah,
done in a really
yeah.
open, honest, and kind way. So
Yeah. And I
yeah.
think I once had a family who actually thanked me for my kindness because they said, you're so honest with us and we really appreciate you're the first person who's been honest and so kind to actually tell us the truth.
Mm, yeah, yeah. Love that. All right. Tell us about bioethics. You did a lot of teaching in this area. What
Yeah.
is bioethics? Tell us about what would we expect if we were going to a bioethics kind of training? What's in there?
Well, there's the geeky philosophy side that, but I think, so I appreciate the philosophy side, but I really liked is I think it mirrors the critical thinking that we use in medicine. So I think, if you understand, I mean, I taught learners, the ones that really understood bioethics also could then use that same sort of thinking um, to, uh, to apply to clinical medicine and clinical decision making.
Mhm,
So in the same ways that we can analyze, the ethical aspects of, a particular clinical case, we can apply, it's about gathering data, it's about understanding, um, but it's an appreciation, I think that for me complemented my medical practice. So it's really an appreciation of values, an appreciation of underlying beliefs, the kinds of things that impact on people's decision making.
mhm,
Um, that for families, for sure, that why are they choosing a particular direction in terms of decision making, and not to make assumptions about that everyone thinks exactly the same way that we do.
mm,
So I think for me, it just broadened a way of thinking or appreciation of how people thought about issues. Anyone who trains in bioethics also gets, a good healthy dose of health law. But the difference between health law and bioethics is important as well. So understanding the legal framework in which, the regulatory framework in which physicians and other health professionals work is important. But then bioethics is about, I don't know, it's about embracing the gray, gray zone, right? There's no right answer.
mm,
There's no single, generally not a single right answer. There's a lot of nuance and there's a lot of gray. And so being able to, I guess, navigate ambiguity and uncertainty, I think is where what I really loved about bioethics.
mhm. I understand why this is important for us because we do still throughout our career come across the patient who doesn't want to go ahead with something that we think could be
Mm.
curative for them,
Yeah.
right? As an
Mhm.
example,
Yeah,
one of the
absolutely.
examples.
Yeah.
And or in your case, I guess in pediatrics, a parent who does want to do step 1 or 2, but not step 3 and 4 for their
Mhm.
child for this diagnosis. And the the internal struggle as the treating physician, watching the patient navigate that decision for themselves and not wanting to, you know, micromanage their decision making and really turn them away from medicine is a potential problem you could have with your
Yeah.
own assumptions, your own decisions for them,
Yeah.
and
Yeah.
watching them be able to just flesh out in front of you what it is about this information that they have, why it is that they're making this decision, what information they might need in order to make a more informed decision, and then watching your internal process as that all happens.
Yeah, absolutely. And what you just said, like maybe they need more information, or maybe they need information explained in a way that, is away from our medical model. Like, I mean, we have a medical model, we have a way of thinking about information, we have a way of thinking about probability, risk,
Mm-hmm.
that's, very medicalized,
Mm.
and people don't always come from that same background. So
Yes.
sometimes if I didn't understand why people were making decisions, first of all, get curious, ask questions, try to understand where they're coming from, what
Mm-hmm.
they're thinking, and where they're at. But then that also maybe provides some opening into, well, maybe there isn't, we didn't explain things very well to you. Maybe and in the end, like, I mean, for children, there's certain situations, of course, that we get into that the parents
Mm.
refuse treatment for their children, that, there are, guidelines for when it's acceptable for us to respect their wishes, and other times when we would actually, intervene,
Mm.
child protection.
Mm-hmm.
Um, legislation, but
Yeah. And
yeah,
that's that law versus
that's the
bioethics.
law versus bioethics. Yeah, definitely there's a threshold. Yeah. But most times we're not dealing with that. We're dealing more with the ethics side
Yeah.
because, when we cross a certain line, then the law actually makes it really easy. That's where we have the right answer and versus the wrong answer. Whereas in bioethics, it's this nuanced gray zone. Like, how do we support? And I guess I looked at it as how do we support the families um, in a way that respects their values, that respects their wishes, and still kind of also tries to incorporate the best interests of the child.
Mm, mm, yeah. I think personally I wasn't as good at this until I'd done coaching, where I could
Mm.
really truly learn to put down my own opinion
Yeah.
about what the patient should do. Like really
Mm.
truly left that outside the room
Yeah.
and was able to say to the patient, what are you thinking right now with the information you're given? And why, and just being able to get curious without me still thinking in my head, of course they should do the surgery. Of course they're going to say yes to the surgery. Just literally leaving that opinion outside the room and letting the patient know, surgery or not surgery, that's, right now that is, I'm not invested either way.
Right. Yeah.
And
Well,
taking that into even smaller and smaller, taking this medication, not taking this medication, I'm going to leave my opinion outside the room.
yeah.
And so learning that skill took many years, but it also took that extra level of training.
Yeah. Yeah.
Yeah.
Interesting. Right. And I think, what I learned, maybe again through my bioethics practice, is that, many conversations that I think we have in healthcare are about getting a decision.
Mm,
And so what I used to teach is that, when we're having conversations about, do not resuscitate orders or, preferences for treatment, um, that sometimes it was helpful just to have a conversation to
mm.
share information and to
Yeah.
listen. So I actually would even tell the families, I said, I'm not here actually to make a decision. I
Yeah.
actually, so ahead of time, this is the goal. There's
Yeah.
no goal, there's no objective, the only purpose is you wanted some information and I'm here to share some information
Mhm.
with you to help you later when you may need to
Mhm.
make a decision. So I think
Yeah.
that's the other thing I learned. I think it's just what you said about coaching reminds me of that idea that we are here. Sometimes our goal, if we take away the decision,
Yes.
then we have a very different kind of conversation with
Yes.
our
Yeah.
patients and the families.
Yes, agree. I don't know that we often get given the time we would prefer to have with patients.
Yeah,
I can see surgeons in their
yeah,
office thinking,
yeah,
I'm going to have to get the back if I want to have that conversation and then
yeah.
have the decision making another day. And that's going to add, another
Right.
appointment. But, but it is so helpful.
Yeah. I think it's
Because
so
it
helpful.
may feel a patient's like pressured to make a decision and then they
Yeah,
change their mind when they have time to think about it. And then
yeah,
that's
yeah.
wasting your time too.
That's right. And that's the way I look at it too. It's like, what a waste of time. Or what if they canceled the day of surgery, because they felt pressured. They didn't feel they were ready to make that decision. So I know there's a lot of pressures and so
Mhm.
I'm trying to be realistic, knowing that there's a
Yes.
lot of pressures and time pressures and big waiting lists of patients to be seen. So all of that pressure is on physicians. But I do think, when we do have the time, and I guess my experience is that we sometimes think we don't have the time, and that's when we miss the opportunity. There are times that there realistically isn't a lot of time, but I think sometimes we artificially think there's not enough time,
Mhm.
and so we just rush the process, and as you say, it sometimes actually ends up in the end being a problem later on when
Mhm.
we actually have to have the conversation again because the day of
Yeah.
surgery they decide to cancel or
Mhm. Yeah. Agree. Got it. Perfect. Okay, so that bioethics part. Now, what got you interested in medico-legal and what did you do in that environment?
Yeah, so I mean, I ended up, working with a coach at the when I was feeling burnt out in my clinical practice. And I think at that point, I, sort of explored different career options. What am I going to do with medicine? So the opportunity came up to work with our medical indemnity organization in Canada. So the CMPA, as I mentioned. The initial opportunity was actually to work as an educator in that field. So I used to do medical presentations to physicians across Canada, talking about various medical legal topics. I think it attracted me because I'd already done this training in bioethics, and as I said, we did learn about health law, and it was an interesting aspect of practice, and it was a way for me to continue to be a physician, feel like a physician, that I was actually using, as we call it, medical brain. I'm still using my medical brain, but I'm also learning something new. So it was really an opportunity to learn something new, and a different way to help, instead of patients, help my colleagues. So I that really appealed to me to make that
Hmm.
shift.
Yeah. Can you tell us more about the burnout story, the areas that you're happy to share about that? What did it look like for you, and what was the process of navigating the help you needed?
I mean, the parts that I think, if I go back and look at my clinical time, I think burnout, first of all, was not like something that hit me. It, and now having supported other physicians going through burnout, it is something that I think it's insidious. It, it develops before you have no idea it's happening, and it's progressive and it's gradual and it's erosive. And unfortunately, my experience when I think reached the point where I realized I was burnt out. Um, and I think, I think this is I feel like this is probably what happens to a lot of physicians, that, the one area that's probably the most preserved, when we're burnt out, is our clinical practice and how we speak to patients. So,
Hmm.
that's probably the one place where, like, the last place to go is, how we talk to patients. Everything before that, like, how do I talk to my spouse? How do I talk to my friends? How frazzled do I feel? How do I look to nurses and my other colleagues?
Hmm.
I think that happened, earlier. So I think I was still able to, keep a game face on when talking to, parents and families, because that was, like, I think for physicians, that's the last reserve. That's the place where we can kind of keep it together. And I think when it falls apart, then that's a problem.
Hmm.
So I think it was really just an insidious process. And when I realized it was, I spoke to some of my colleagues, and I said, I think I need some help. I think I'm burnt out. And unfortunately, some of the advice I got was, hang in there, you're strong, it'll get better.
Hmm.
Um, and when I talked to some of my colleagues afterwards, and they said, "Yeah, we were so wrong to tell you that. We were so wrong to, um, uh, yeah, to dismiss what you're feeling, because you are a strong person." And so the fact that I was actually asking for help and looking for help, should have told them, this is really bad, and Ellen's actually asking for help, and
Hmm.
she's not the kind of person who would normally, come to us with something like small or trivial. So I think
Hmm.
that's what it was. So I think, yeah, so I had the opportunity to hire a coach. And that was the first time a friend of mine told me about it. I said, "What's a coach? What do they do?" So I worked with a coach for 2 years, actually. Um, and, uh, and yeah, and learned a lot about myself, learned a lot about, the things that I think were setting me up for burnout and challenges at work, and not being able to navigate them well.
Hmm.
And I think, yeah, I mean, and I don't, and certainly my message isn't, oh, working with a coach will always end up leading to you leaving your clinical practice. But I think by the time where I was at, I had a couple of different options, and I chose to, rather than I chose to, yeah, I just chose this pathway. There were
Hmm.
other options. There were a number of options I looked into, whether including, just changing my specialty. Maybe I
Hmm.
shouldn't be working pediatric critical care. I could,
Hmm.
retrain and do all those things.
Mm.
Yeah. So
Yeah, okay.
I looked at a lot of different things.
Yeah. Yeah.
Yeah.
Time off, did you have any specific time off when you kind of hit that point of, uh-oh, I've really let myself get to the end of my kind of tether?
Yeah, I had to take, yeah, I took some time off. Yeah, I took a lot of time off actually. So,
Okay.
yeah, it
Okay.
was, as I said, it was really bad. Um,
No, no, that's important to
yeah,
hear because I
yeah.
think you're right that like your colleagues had identified, you're a strong person. If you're asking for help, it means that you really have tried it all yourself
Mhm.
first, and you've recognized that no, I've burnt all my bridges behind me. I really am on the last island.
Yeah, yeah. And I think if I had, I think when I initially said I need help, if someone had said to me, like, let's do some, do some things to help you, then maybe it could been prevented. So the other, I
Mm,
guess I also now operate from the position when I help physicians as a coach that I think, what I'd love to help, sometimes you do need to take time off, and that's the right answer,
mhm,
as well as getting the help that you need. Maybe if we recognize this earlier or our colleagues support us earlier, maybe there's a way that, instead of stopping work completely,
mhm,
that you can actually continue to work or work a little bit less or make some adjustments and while you're getting the help that you need. So there's not one single
mhm.
pathway when that happens. But
Yeah.
I was definitely in a bad state.
Yeah, no, thank you for that. That just helps listeners to kind of identify where they might be along that trajectory when they're deciding for themselves if they're recognizing those signs of burnout. So yeah, it's good, very
Mhm.
helpful. Okay.
Yeah.
All right. So anything about your practice within the medico-legal environment that would be helpful for us to understand that could be alleviate some of this things that we worry about, maybe about the medico-legal parts of we were talking maybe about whether there's you're going to come at it from a different perspective because you worked in
Yeah.
different areas of medico-legal, so I'll let you take the floor.
Yeah. Well, I feel like the physicians need, first of all, feel very alone.
Hmm.
So it's to get to good, sorry, it's good to get advice and help and support from your colleagues with these kinds of questions.
Yeah.
Yeah, medical legal things, so on one hand, I think physicians worry a lot about medical legal consequences, worry a lot about, I'll just say lawsuits,
Hmm.
complaints, regulatory complaints. That's the greatest, and typically, with physicians, the greatest fear is that I'm going to lose my license. I'm not going to be able to practice
Hmm.
anymore. So that's, the end of the road. But that's probably still hangs over a lot of physicians' heads.
Mm.
And I think recognizing how important that is as a stressor for some physicians is what I've learned in the time that I've spent in the medical legal world, is just even understanding how much of an impact it can have on physicians, how much of an
Mhm.
impact being sued can have on some physicians. I've seen some physicians actually choose to leave practice because it was so stressful. It had a lot of impact on their self-confidence
Mhm.
and their well-being. Uh, and I think the other thing, I would say, and based on my own experience, is that I don't think our colleagues are always that helpful in supporting
Mhm.
us. Um,
Mhm.
because we don't, first of all, we don't like to talk about it. We don't,
Mhm.
I once told somebody, the first time I was ever named in a lawsuit, I told a colleague and she says, well, that's interesting. Uh, I'm sure you'll get through it. It's never happened to me, and it didn't make me feel very good about myself because it was actually very early on in my practice that happened. Whereas
Yeah.
other colleagues that I've run into, subsequently, like if they've had their own experience and they're willing to talk about it, then they'll be more supportive. So I
Mhm.
think, certainly one of the things that I found helpful, yeah, is being able to have someone that you can actually talk to about about this.
Yeah,
about
yeah.
these
And I
about
know
these.
sometimes we're given instruction, don't talk about the case or don't
Yeah,
talk about what's
right,
happening, but it doesn't stop you with the go get the support you need,
right, exactly.
right? Go
Yeah,
get looked
exactly. Yeah.
after, and
Mhm.
hopefully by somebody who understands or is at least empathetic towards what's going on for you as a person, as a
Yeah,
human, and as a
right.
physician. Even if you
Yeah,
can't talk about the specifics,
yeah,
you can talk about how you're feeling
yeah, yeah,
and get some support. Yes.
yeah,
So
yeah.
important. Yes.
Yeah. And even with learners, like, like when we started to share, like, and say, well, I've been sued, and they're like, gasp. And it's like,
Yeah.
oh, well, you're a good physician. Right. So I think that's the other thing is that, just because you have a complaint or just because you have a lawsuit or more than one of those, it's not representative of the entirety of the quality of your practice and representative of how all patients or feel about you and your care. But that's for a lot of physicians, it might feel that way. It
Mm,
might feel like, now suddenly it's like when you get one bad evaluation if you're a teacher, that one bad evaluation has an impact on you. The complaints, lawsuits for physicians can have similarly that, because of that negative bias that we have, that, these negative things that happen to us have, are overrepresented in our brain than compared to all
mm.
the good things that we do to help patients.
Yes, yes, yes. Thank you. I think that's very important to hear that you are more than this one complaint. You are more than this one negative review. You are more than this feedback that you've been given. And it's not, it doesn't define who you are.
Yeah,
It doesn't negate all of the good
yeah,
or you as a person.
yeah,
Yes.
yeah.
So important, so important. All right, tell us about coaching. So what enticed you to then go and move into the coaching world, and what are you doing in there?
Yeah, so I think after I got coach, I thought, well, I mean, you've been through this training. I actually think coaching actually changes everything about your life, changes the way that you see things, changes the way that you talk to your colleagues. So I had a few colleagues who just, this was before I got my training as a coach, but they said, "Oh, you seem like you know what you're talking about," or maybe this would be an area that you want to be interested in doing because you're really good at talking to me. And again, what I learned is don't solve other people's problems for them. Just listen and get help them reflect and help them maybe see their blind spots. So I decided to eventually pursue formal training as a coach, and I did that. And yeah, and so I did a lot of coaching. I introduced coaching to this program in our medical legal organization, and now yeah, I want to continue with that and continue to be able to support physicians. I also coach people who are not physicians or outside of the healthcare field, but yeah, because of my experiences and my understanding and having spent a lot of the last 5 years coaching physicians, I think I think there's a lot of need out there.
Mm,
And I don't know that a lot of physicians even are aware that coaching is a resource that could support them, um, and and support them hopefully to stay in practice and but also have more fulfilling practices and like the work that you're doing to support physicians. Paperwork is a huge issue, for example. Even just be able to overcome that obstacle and you know so that they don't spend all of their time doing this in their non-working hours, um,
yeah,
and
yeah.
have, I guess, find better balance, and find and refine the joy, um,
Mm.
what brought them to medicine in the first place.
Yeah, yeah, which is so important because we can lose ourselves and lose our joy in the day-to-day working of our world. So yeah, that's really, really important. I think in Canada, I've noticed that there is some funding available in many provinces, either through
Mhm.
the medical associations or
Yeah.
so look into it if you're kind of
Mhm.
thinking about would coaching be good for me? What's available? Just look into
Yeah.
some of the physician wellness places because you may find that there is some funding available
Mhm.
or some coaches available that are
Yeah.
for our Canadian physicians already included in some of the things that you pay for.
Yeah, I think so. Sometimes, yeah, so there's sometimes funding that's available to support physicians through that. I think that the new thing too is, well, that physicians could also claim it as part of their professional development credits. That's relatively new. So, in the same way that we pay for a conference,
Yes.
to attend a conference, we can actually claim, the hours spent being recipients of coaching as part of our, professional development credits. So it's just another way of also, because it is, it's just another opportunity to improve your practice and change your thinking and, even explore, and it's, I suspect your work, supporting physicians with charting, documentation challenges. My work similarly, documentation challenge sometimes, or the mountain of backlog of work is a symptom of something else that's going on. So, and so if we address what that underlying, what the underlying issue is, then the paperwork is easy, I guess, easier to solve. Not easy. I don't want to make it seem like it's so easy, but it's easier to solve because there often is something else that's actually in the way, getting in the way of that.
Yeah, no, good point. I think the Royal College for our specialists, it's 3 credits per hour. Main pro credits you can also get if you're a family doctor for any time you spend with a coach around your physician work. So yeah, just some other handy hints to know as a Canadian. So love it.
Yeah.
Ellen, anything we didn't talk about that we should talk about?
Oh my goodness. Yeah. As you bring up these various topics, it feels like, oh, how many hours do we have in this podcast to talk about this? But I think there's so much. I guess I want to encourage physicians, like, don't be alone, get the help that you need. There is help out there. There are people who have a lot of experience coaching physicians, and supporting physicians, work like you are doing, work like myself and other physician coaches in Canada, and elsewhere, in all sorts of other countries as well. But there is a different kind of support. And I guess unlike, I would say, unlike other types of support, this is really about empowering you to be successful. We're and I love the work because I think, we have such an important role to play in people's lives. And I, by and large, have so much admiration for the physicians I work with, that, this is what powers me. This is what energizes me, is to be able to support and help physicians.
Yeah, love it. Where do people find you if they're looking to connect with you?
So they can find me through my website. I have a website. So www.epowercoaching.com. I'm also a member of the Canadian Physician Coaches Network. So there we have a directory. There's other physician coaches there as well. But the best way, is to go through my website, epowercoaching.com.
Wonderful. Well, thank you so much for this conversation, and you all have a wonderful rest of your week.
Okay. Thank you, Sarah.
Bye, everyone. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.